expensive creams at the grocery store erase cellulite? Are the injections used to smooth out wrinkles actually poison? And will the toothpaste really make a pimple disappear? Right now, we're getting answers about beauty myths from dermatologist Dr. Doris Day. Welcome back.
Thanks for having me.
So, in your office, every day, you say women come in, say they've tried this or that, they're wondering if this or that is true, and you're here to just debunk anything that's not true.
Absolutely.
We want to actually start with injectable myths. So a lot of people think that they are putting poison into their face, so they're worried about it. Maybe it's a reason for not doing it. Is it bad for you? How do we know?
You know, there are so many myths out there, and it is really scary. People think it's a poison or they'll be frozen. And frankly, you know, we see these faces on a daily basis.
Some people go
too much in the cheeks, too much in the lips.
Right.
But the reality is, as scary as that is, what's really scary is all the misinformation. These are FDA-approved products, and there's different categories. The products are safe. Everything has a risk, but they have to be done properly. First are the neuromodulators like Botox, Xeomin, and Dysport.
Okay.
These ones help relax facial expression. They're approved for between the eyes, but we use them in the crow's feet and the chin, and it's a global aesthetic. Then there are injectables. People ask for Botox here. No. That doesn't go there.
Why?
It goes between the eyes because it's not a filler. It's designed to relax expression, and it creates balance. It's not about not being able to move. It's about moving naturally.
Okay.
And then you have the fillers. Restylane and Juvederm are the most commonly used one in the hyaluronic acid family. It's natural to the skin, which is really great, and it helps your skin look its very best. So it's a global aesthetic. You can see in the before and after. She looks better after, but you can't tell that she's had anything done. And even when she smiles, it's not about getting rid of every line and wrinkle.
What do you say to these people who come in and they want more and more and more? I mean, do you
I say absolutely not.
Do you?
Yeah. You cut people off. You do like last call.
I have
on
no
the
problem.
Botox.
That's where you need the aesthetic judgment. You know, the most undertreated place, can you guess where it is? It's the temples.
Over here?
Over here in the temples. Don't look left or right, but when you're walking around, you'll start to notice that people get sunken in the temples, and just rounding that out gives a lift. The chin, when you reflate the chin, women's chin recedes as we get older. When you rebalance that with a little bit of filler, a little bit of Botox, then it looks natural and not done. It's the effect of a lift, the way that we do it.
Good
so there's a lot to know.
It's so 20th century.
Right, who needs to do that? Acne myths. Okay, a lot of people say that if they have acne in the teens, that it's something that they're just going to grow out of, that they'll never face again. You say?
I say, unfortunately, you don't always outgrow your acne when you hit your 20s and 30s, and some women don't even get acne till they're in their 20s or 30s.
Well, pregnancy sometimes brings it on, right?
Pregnancy can bring it out as well, and there's really nothing worse than you're getting the pimples and the wrinkles. So you have to be really careful. That just seems morally wrong.
What about people attributing food to acne? Like, oh, you ate, you know, greasy burger the night before, and now you're breaking out.
True?
Is that?
No.
No.
So sometimes when people insist, I say, okay, well, don't eat those foods. They're not good for you anyway. But there's no scientific study that associates greasy food or chocolate with acne. The only food group that we've seen a direct association is dairy. So if your acne is really bad or not getting better with treatment, try dropping dairy and see if that helps.
Sometimes they say clogged pores, so like makeup clogs your pores. What about makeup?
That's makeup that's too heavy and not cleansed off properly, but no, makeup is okay to wear also.
Do you like those brushes that they sell?
I love those brushes. I do. And they're great over-the-counter products and ingredients you can look for. Look for ingredients like salicylic acid and benzoyl peroxide and witch hazel, aloe. And there are products that have combinations of these. So there's really great drugstore products, but sometimes you need a dermatologist. We have in-office treatments. This is the isolase being done, and you can see that it's not painful. It deep cleans the pores, so it sucks everything out of the pores, and then there's an intense pulse light that can kill the bacteria.
They do something like that in a facial these days.
It's a little bit stronger than the facial. This is a medical thing, but there's one thing you don't want to do is wipe alcohol pads on the face.
No good.
Has no effect.
None?
How about witch hazel? That causes acne.
Witch
hazel is good.
Okay.
But the alcohol pads won't do anything to the acne at all, and it'll dry out your skin, so you'll have acne and dry, irritated skin.
Okay, what about popping pimples, though?
Okay, what's the single worst thing you can do to a pimple? Right, that means you've done it. You only know the answer if you've done it, so that was a trick question.
Everyone's done it.
That's right.
Because who wants to see that?
Yeah. So what that does is it just makes it mad. These are not surgical instruments. It does. It lasts weeks to months longer. It's more likely to scar, more likely to come back. see your dermatologist, use these products. There's lots you can do, but don't pop it. And toothpaste doesn't help. Always brush your teeth before you wash your face, because toothpaste can irritate. Now they have all these whiteners and things in there, so don't use toothpaste.
Okay. Well, there goes that was my myth buster. Drugstore myths. Now, many people think that they could never possibly find something in the drugstore that's affordable that would work the same as something expensive.
Right. I'll just say I've never seen anything in the $400 to $600 price range that's worth the money. I just haven't seen any clinical data for any of those products. I did bring one that's a little bit pricier.
Really cheap ones.
Right. So then there are products that are inexpensive that are good, and I brought some examples of those. I'm a big drugstore girl, so I am in that drugstore looking at products, and there are ingredients you look for. Okay. Things like retinol, niacinamide, caffeine, antioxidants, peptides, those are good. I look for the brand names because they have these incredibly bright PhDs working in laboratories to come up with these products, and the money doesn't go into packaging, it goes into ingredients. So I really like those. Some are a little bit more expensive. You can ask your dermatologist, but that very high price range where they put, you know, some of them have like bird poop in them, like all these exotic things, snake venom, all these weird things, and caviar and gold and diamonds. Diamonds are jewelry, not face products, okay?
What about the cellulite claims that are out there, like the creams that erase cellulite? They say, I mean, how do we know which ones work and which ones don't?
They have a lot of the same ingredients in terms of botanicals and retinol and niacinamide and caffeine that can make the skin look better. And there are some more advanced ones that can do a little bit more. I brought an example as well. So there are things that you can use that I really like. This is Nectafirmin. It's for smoothing out the neck, but you can use it on the body too. Vichy, there are other great products that can help look better. Lactic acid is a good ingredient, gently exfoliates and hydrates. It's a temporary effect. Beware of what over-delivers.
Okay. Be careful, you know, if you use it.
Promises on what it delivers.
After the hour's over or whatever, just put your cover up back on, I guess. Our thanks to Dr. Day. Members of our audience are going home with products from some of these companies. We'll be right back.